Hi, welcome back to the marketplace and to the exchange. Ghana's health budget for 2026 has gone up, but policy analysts say it still falls short of what is needed to deliver quality health care for all. To help us unpack what the numbers really mean for the ordinary Ghanaian, we are joined on Zoom by Emmanuel Opuni, who is Executive Director of the Center for Health Policy and Development Africa for the exchange. Good afternoon to you. Happy to have you on the marketplace. Now, the government says the 2026 health budget has increased by 23% on the surface. That sounds impressive. From your analysis, why do you say Ghana is still falling short of its health financing commitments?
Thank you very much, Darrell. Thank you for having me here. Yes, we must commend the government for that increase. It is commendable. But if you compare with our regional and global commitments, that's where we fall short. For example, we are committed to the Abuja regional Abuja declaration, which is supposed to be about 15% of the total budget. But even if we add national health insurance levy, we are around 10%. So we are 5% away from the Abuja declaration of 15% of total budget. Also, we are committed to the global benchmark of 5% of GDP proposed by the World Health Organization. Currently, our health budget as compared to the GDP is about 2%. But we need 5% to be able to reach the benchmark. And certainly, there are critical needs all over the country that needs funding to be able to solve. For example, there is only one cardiothoracic surgery center in Ghana, which is in Accra. And we all witnessed the death of a medical officer who was practicing in Kumasi, and he wanted to come to Accra to have the surgery in Accra, and he died before he reached the hospital. So there are a lot of needs around the country that if we are able to increase our funding for the health, we'll be able to solve.
So nearly half of the health budget is spent on compensation while goods and services and capital investment remain relatively low. What risks does this spending pattern pose for healthcare delivery, especially at the primary care level?
Yeah, thank you very much. Over the years, if you look at Ghana's budget we have analyzed from 2015, we realized that salaries and compensations are going higher and higher. And that is not bad in itself. But when governments have pressure, they use the budgets for capital expenditure and goods and services to pay salaries. And so when they do that, then it affects capital goods, it affects goods and services. So health workers may be there, but they don't even have the equipment, the materials they need to be able to serve our people. So it is imperative for us to increase the health budget generally, so we can pay the health workers and also have funding for capital expenditure and goods and services, so that operations can go on very well for Ghanaians to achieve the universal health coverage and the sustainable development goal, right?
Yeah, and your analysis also shows a growing reliance on internally generated funds, including user fees. How could this affect vulnerable households and Ghana's goal of universal health coverage?
Okay, internally generated fund is not bad in itself, it's good, but a component of it is user fees. That's say people go to the hospitals and they are expected to pay some fees to be able to get the services. And a lot of our people who are in the lower tier of income suffer, because when they pay such fees, it affects, for example, their food, the funding on food, the money they use on food. And Bar Abeka and his friends have done some research in that area that indicated that about 60% of people who go to hospital suffer what we call catastrophic expenditure. That means that they pay the hospital fees, they pay the fees there, and they are not able to buy food, for example, or it affects the kind of food they eat. And that has also got health dimension. So our advice is that Ghana Health Service and the Ministry of Health try to analyze that very well. So they increase other components of the internally generated funds for the hospitals to get money to run them. But we should find a way of also cushioning the poor so that the poor will not suffer too much.
And it also appears mental health, disease prevention, and digital health are underfunded in the 2026 budget. What are the long-term consequences if these areas continue to receive limited attention?
Yes, thank you. There are long-term effects. For example, mental health prevalence is going up. The number of cases that are happening, not only in Ghana, all over the world, but for some, now we are considering Ghana. So the cases are going up. And we know that if somebody has mental health, apart from the fact that he himself is not productive, he will also need somebody else to take care of him. And so mental health is one of the most expensive sicknesses. So if mental health is allowed to go on without prevention and some of those things, it will affect productivity so much. And also disease prevention in general. If we don't prevent diseases, for example, NCDs, by 1990, there was the number of people who died from non-communicable disease were only 28%. And the recent research says that 45% of deaths are attributed to non-communicable diseases. So if you look at the difference, if we allow this trend to go on, you can realize that a time will come that majority of our people will be affected by non-communicable diseases, and that could affect productivity generally, and it will affect Ghana's economy and all that, to affect families, to affect the nation, to affect everybody. So it is imperative that we find strategies to prevent such things, and also digital health. Technology is very, very important, and it is running very fast. It has so many advantages, for example, efficiency and effectiveness in diagnosis and cure. So if it is underfunded, we will get behind. The world is going forward. The world is going far forward. So if we don't do much about it, for example, we are only spending 10 million cedis on e-health in 2026. So if we don't catch up, Ghana will be behind, and we will spend far more money in medicines and other things, which may not even do the work for us.
All right, let's look ahead as we conclude. What are the two top or three policy actions that you think the government should undertake if we are to realistically achieve universal health coverage and SDG 3? Okay,
thank you very much. Our first proposal is that we should have a national preventive health fund with emphasis on NCDs and some infectious diseases and disease surveillance and things like that. Because if we allow this trend to go on, there will be more sick people, and this will affect productivity. So it is very, very necessary that we have a national health preventive fund to be able to fund health promotion, policies, and research, which can help us prevent diseases. And then the next thing that we want to emphasize is increase of capital expenditure, especially in the rural areas. Because if you look at ISE's Institute of Statistical Social and Economic Research report in 2022, April report in 2022, they said that 73% of our rural areas do not have hospital in 5 kilometers.
Right.
Which is very, very serious. So we should increase the capital expenditure, build more hospitals, more cheap compounds and things like that, primary health care in our rural areas, so that the gap can be closed.
Thank you so much. Appreciate it. Emmanuel Puni, Executive Director of the Center for Health Policy and Development Africa. Appreciate your time on the exchange. And that's the marketplace, everybody. Thanks for watching. There is more news on our website, myjoyonline.com/business. My name is Darryl Kwao. Thanks for watching. We will be back same time tomorrow.